Okay, my name's Jennifer Smith. I'm going to be doing your abdominal assessment today. Perform hand hygiene. I've identified my patient with 2 patient identifiers, checked the armband, and he has emptied his bladder. So we're going to start with inspection, noting the color, vascularity, if there's any striae, lesions on the abdomen. And so he does have some round brown moles. There are no other discolorations or bruises noted, and no dilated veins or surface arterioles, and no dark blue-pink striae, and no wounds or scars. The skin tone around the umbilicus is the same as the other skin, and the skin on the abdomen is slightly lighter than skin exposed to the sun. The contour of the abdomen is rounded. The abdomen is symmetrical with no bulges. Can you raise your head just a little bit? No bulges when the patient raises his head. Slight movement noted with respirations. And there is a slight pulsation of the abdominal aorta. So now we'll start with auscultation, noting the pitch and frequency. We'll start in the right lower quadrant where the ileocecal valve is, which is where the small intestines empties into the large intestines. And we're going to count for a full minute in that area, and then we'll listen at the other areas. If we do not hear bowel sounds in 1 minute, we'll listen for a total of 5 minutes before saying bowel sounds are absent. And this is with the diaphragm. And we'll say that's a minute and 25 sounds per minute. Bowel sounds present times 4 quadrants, soft clicks and gurgles. Now we will auscultate vascular sounds and friction rubs. We'll auscultate the abdominal aorta. And this is with the bowel of the stethoscope. This is slightly to the left of the midline. And then we listen over the liver. And the spleen. No bruit heard over the abdominal aorta, and no hums heard over no friction rubs heard over the liver or the spleen. So we will also listen to the renal arteries, the iliac arteries, and the femoral arteries. The renal arteries are on both sides of the aorta, above the umbilicus. The iliac arteries are just slightly below the umbilicus. So they should be using the bowel. and then the femoral arteries on both sides of the groin. Okay. Then moving on to percussion, we will percuss all 4 quadrants of the abdomen. And this is, you hold one finger down and you tap, you hold the other fingers up. Tympany heard over most of the abdomen. There will be dullness over the liver and the spleen. And then we'll percuss the liver and measure the span. So we will start low and move up. Okay, you can hear where that changed to dull. We'll mark here. And then we'll start up and come down. Okay, try that again. Okay, right there. Okay, this is the measurement at the mid-clavicular line. If you measure at the sternal midline, it will be a smaller measurement. This measures it's actually about 9 centimeters. And then we'll do blunt percussion of the kidneys at the end, just because he has to sit up for that. But typically you would do it when you're assessing the lungs and thorax. Now we'll move on to palpation and start with light palpation of all 4 quadrants. And you'll use your fingertips for this with just a little rocking motion. Any pain or tenderness? Okay, and then deep palpation of all 4 quadrants, and you'll use the palmar surface of your fingers. Okay, and then we will palpate the aorta, and you can use your thumb and finger or 2 hands. And so okay, there we go. The aorta is approximately 2.5 centimeters with moderately strong and regular pulse. And then to palpate the liver, there's 2 different methods. There's bimanual, which would be placing your non-dominant hand under the patient on the right side. And then, okay, and the liver typically is not palpable. Or then there's also the hook method, which you find the rib and go out a little bit and go under. And the liver is not palpable. And then we'll palpate for the bladder, which the bladder should not be palpable unless it's distended. Okay, not palpable. Okay, we'll have you sit up now on the side of the table. Okay. Now, it's for blunt percussion of the kidney. Can you hold your shirt up just a little bit for me? We are going to percuss at the costovertebral angle. Okay. You place your hand flat and then tap. Any pain there? Okay, and that concludes our abdominal assessment.